Hi, and welcome back to Consider This. We're going to do another week where we are tracking COVID-19 data here in St. Joseph County. So let's go ahead and get started. So just like in previous weeks, I have several slides that are exactly the same, have the same information, and then I've added several new slides for some new topics that I want to talk to you about. So this is the new cases, which represents the 7-day rolling average. And again, as a reminder, the 7-day rolling average is where we take the previous 7 days of new cases and divide that so that we get an average for a particular day. So as you can see, this is the trend. We've been talking about this already now for a few weeks, where at the beginning of September, we were having approximately 40 new cases per day. And now in the last couple of weeks, we have been going between 2.5 times more or even 3 times more than what we were seeing in early September. Here are the number of active cases for the preceding 14 days. And so this statistic is computed in a very similar way to that of the new cases. This one just looks at the previous 14 days and then takes the average. And as you can see, it is exactly the same as the previous chart. The trends are very much the same. That in September, we were at a lower number, and here we were at 847 active cases at the beginning of September. We took this little dip, but now since September 18th, we are steadily increasing, and now we are at 1,568 active cases on average per day, and that is double from where we were on September 10th. Here's the percent positivity. Again, since the last few weeks that we've been talking, this has not changed. The trend has not really changed. We had a high here at the beginning of September at 6.4. And again, we dipped down, we came up a little bit down, and now we've been on an uptick and we are back at that 6.3%. This is a chart that represents the R0, or the community transmission. And at the beginning of September, we had a very low transmission rate at 0.36. We had steadily actually saw a pretty steep increase to 1.11, and then we've seen a decrease but again, we are increasing. And as just a reminder about how this R0 is calculated, or what it represents first, let me say that. So when the R0 is above 1, above 1.0, that means that for every one person who is positive for COVID, they are transmitting on average to one other person. So if the R0 is below 1.0, that suggests that the cases are shrinking in our community. If it exceeds 1.0, that means that there's an expansion of cases in our community. It's a complicated statistic. It takes into account a lot of factors. So again, we don't just use one statistic to tell us what's happening in our community. We put together a lot of metrics to understand what's happening in our community. And here's the representation of that. So when we're looking to talk about what is happening with our community, we need to look at all the factors. What are the new cases? What are our active cases? What's the percent positive? And then finally, what does this community transmission look like? And then lastly, we need to listen to our community. We need to be talking to the folks, the medical directors of hospitals, of clinics, people who are in the community and working directly with the community. It's all of these factors that you put together before you start making decisions about your own community. So here's a new chart that I haven't had before, and this is from the St. Joe County Health Department's press release. But this is the trends in COVID hospitalizations and cases for St. Joe County. And so in the blue line, you will see that the blue line is the COVID hospitalizations, and that the orange line represents that 7-day case average. So you can see very clearly how these lines mimic each other, that these trends are nearly identical, so that when you see an increase In the 7-day cases, which is exactly what's represented here, and that's exactly what's happening now, you will then see a corresponding increase in the COVID hospitalizations. And right now we are experiencing significant increases in both new cases as well as hospitalizations. So there's also been a lot of talk about the fatalities that are related to COVID, and I thought including this chart would also be helpful. Last week I had talked about the fact that October was seeing more deaths than any previous month, and that is exactly right. So you can see here, the blue represents, the total bar represents all deaths in a particular month. The blue bar represents the deaths that are attributed to long-term care facilities. And the orange part of the bar are all other deaths outside of long-term care facilities. So as you can see, we had a significant jump in October in terms of deaths from COVID, and that in fact 73% of them were attributed to a long-term care facility. Here's another chart that's outlining the deaths that we've had here in St. Joseph County, again by month. So you can see in March we had just 3 deaths from COVID, and that we had increased, and in the summer there was a little bit of a decrease, but that now in October, and this was 49 deaths in October, ending the 3rd week in October. And now with the completion of the month, we've now seen 61 deaths from COVID at the end of October, which represents about a 2.5% increase from September. So we have increase of cases and an increase in deaths here in St. Joseph County. So I want to say a little bit more about hospitalizations and what's happening with our local hospitals. And you may have heard some of this in our local newspapers, on the local news. So I grabbed some of these headlines and put them together here for you, so you can understand what is happening locally. And what I mean by when I say we listen to our local health leaders and community leaders about what's happening before we make public health decisions about our community. So here's what's happening in our community. A local hospital has gone on diversion several times. Diversion means that they've actually had to divert ambulances from their emergency room because they are at capacity. A number of hospitals have reported in the last couple of weeks that they're operating at capacity, or that in fact they're exceeding capacity in their hospital. They are recording record numbers of COVID patients in their hospitals. There are elective procedures are being rescheduled intermittently. Staff shortages have been noted with regard to nursing staff as well as physicians. And then burnout is happening. So this seems like a pretty dire situation. And the way that we're going to be able to help this situation, maybe what we should be asking is, what can we do to help that situation? I'm not a physician and I'm not a nurse, and I can't step into a hospital. But what I can do is I can do these 4 things. I can wear a mask, I can social distance, I can avoid crowded spaces and places, and I can do hand washing. And these are important public health strategies that can help reduce the transmission of COVID in our community. And as always, I include these data sources that if you are interested in more information, to please visit these data sources for lots of detailed information. And if you have any questions for me or feedback, please send me an email at consider@nd.edu. It was wonderful to talk to you. It was my pleasure, and I will see you next week.